Hello everyone. In this section, we will be talking about the anti-epileptic drugs. Already in previous section, we have done with the epilepsy. There I have told you about the differences between the seizures and the epilepsy, how seizures can convert into epilepsy. We discussed about the types of the epilepsy over there. For example, partial seizure, generalized seizure or unclassified, for example, infantile or neonatal. We have talked about the simple or complex, which are the part of the partial seizures or focal seizures. Partial seizures, as you know, as I have already mentioned in previous video, that partial seizures can affect one hemisphere of our brain, and the generalized can affect both the hemispheres of the brain. So this was the discussion about the epilepsy in the previous section. In this section, I will be talking about the anti-epileptic drugs. Now we know about the concepts of the epilepsy, so we will be able to understand the anti-epileptics much easily and in much interesting way. So this is the diagram on the basis of which we will discuss about the anti-epileptics. Actually, the mechanism of action underlies within this diagram. What I have drawn over here, that this is the neuron, or you can imagine it as postsynaptic membrane of the neuron, where I have drawn the NMDA receptors, which is N-methyl D-aspartic acid receptor, AMPA receptor, GABA receptor. Here are the sodium channels, here are the T-type calcium channels. However, there are other receptors too, other channels too. For example, potassium channels will also be present over there, as you have already must have studied in the physiology. But these are the receptors or channels which will be very important while discussing the anti-epileptic drugs. That's why I have drawn these receptors or these kind of channels over here. Further, we will study that how different category of drugs apply over here and helps in reducing the episodes of seizures or epilepsy. So actually, if you talk about the anti-epileptic drugs, you can categorize them into various categories, because the abnormal, as I have already said, that epilepsy is the abnormal motor discharge, abnormal electrical signals from the brain. So we need to stop that, and anti-epileptic drugs works like the same mechanism. They blocks the sodium channels, they can block the sodium channels, they can block the glutamate sites. Actually, if you want to know exactly how anti-epileptic works, what they are gonna do, they're gonna stimulate the inhibitory mechanism of our brain. So they're gonna stimulate the inhibition of the brain to stop the abnormal motor discharges, abnormal electrical signals from the brain. And at the same time, also anti-epileptic drugs should minimize the excitatory neurons. Now you must know which are the excitatory neurotransmitters in our brain and which are the inhibitory neurotransmitters in the brain. So excitatory neurotransmitters, you must have studied that excitatory neurotransmitters are aspartate or glutamate and many others, and main inhibitory neurotransmitter is GABA. Okay, so anti-epileptic drugs are gonna inhibit the excitatory neurotransmitter, that is glutamate or aspartate, and they are gonna stimulate the GABA neurotransmitter by the influx of chloride ions. So let's talk about that. Further, we will study the classification, but just right now, just remember what category can help in reducing the episodes of epilepsy or seizures. For example, if we want to inhibit the excitatory neurotransmitters, so there are some drugs which can block these sites over here, NMDA receptors. So what will they do exactly? That actually in the patients of the epilepsy or in the patients of seizures, what is happening over there in their brains, neuronal discharges, that sodium is coming inside the neurons, and they are going to stimulate the membrane, and by the help of depolarization, action potential is moving into the neurons with the adjacent neurons. So if we block these NMDA receptors, the sodium will not be able to enter inside these membranes of the neurons. What will happen? The membrane will not be able to depolarize, and eventually further action potential would not be able to generate in the neurons. So abnormal motor discharges can be stopped over there. So this is the motto of the anti-epileptic drug, which are categorized under the NMDA receptor blockers. Okay. For example, lamotrigine. Now, if you talk about some receptors, AMPA receptors, there are some drugs which can block these receptors. Actually, in the NMDA receptors, there are two kinds of sites: glycine sites and glutamate sites. So this is the glycine site, and these are the glutamate site. So for example, let's assume that this is the presynaptic cleft over here, this is the postsynaptic I have drawn over here, and here the glutamate, this is the glutamate, and this will come over here and binds over there, and which will excite the NMDA receptor, and the sodium influx will start, and which will lead to depolarization, and eventually action potential will be generated in these neurons. But for example, if lamotrigine comes over here, lamotrigine, we will study about this lamotrigine, which actually what it does, that it blocks these glycine site, and what will it do, that sodium will not be able to enter inside, and the depolarization will not be there, and action potential will not be generated. Okay, same in the AMPA receptors, they can block over here, they can cause blockage, and again sodium will not be able to enter inside the cells, and depolarization will not occur. Now let's talk about the GABA receptors. Actually, there are many sites. These are the sites for the phenobarbitals, phenobarbital. These are the GABA sites, and here are the benzodiazepine sites. So here phenobarbital are gonna attach, and here the GABA will gonna attach, and here the benzodiazepines will attach over here. For example, if we take the example, phenobarbitals are categorized under the phenobarbital. So they are gonna cause the GABA agonism. What they will do, that they will cause the influx of chloride ions, and if there will be the influx of the chloride ions, it will not lead to depolarization like the sodium, because for depolarization, sodium and calcium ions are responsible for the depolarization, potassium ions are responsible for the hyperpolarization. This is the basic physiology as far as action potential is concerned. So sodium channels will be able, actually they are responsible for the excitation of the cells, for the depolarization, for the action potential. But GABA, as I told you, that GABA neurotransmitter, they are the inhibitory neurotransmitter. With the help of the chloride ions, they actually increases the threshold. So what will it do, that they increase the level of the threshold, so the cell will not be able to reach the threshold, because the basic rule of action potential is the cell must reach up to the threshold potential for getting the action potential. So if the action, if the threshold potential is increased, so the cell would find difficulty in generating the action potential. Okay, so with the influx of the chloride ions, they actually increase the efflux of the potassium ions, which will cause the hyperpolarization, and the cell will not be able to depolarize very easily. So this is the mechanism of action for the GABA sites. Phenobarbital. If we talk about the GABA example, so sodium valproate. Actually, sodium valproate is the broad spectrum antiepileptic. For example, in antibiotics, you must have studied that there are the broad spectrum antibiotics or wide spectrum or narrow spectrum antibiotics. Likewise, in antiepileptics, sodium valproate is the broad spectrum antiepileptic. How? They can work on the sodium channels, they can increase the influx of the sodium channels, they can increase the influx of the calcium channels. So they can block these channels, and they will be sodium channels will not be able to go inside. Exactly here, calcium channels will not be able to go inside if GABA will bind over here. Here, sodium valproate will cause the influx of the chloride ions and stop the depolarization of the cells, rather cause the hyperpolarization. So this was about the receptors, this was about the functioning of the receptors. We have some drugs about the sodium channels, for example, Phenytoin. Okay, Phenytoin, Carbamazepine, oxcarbamazepine, okay, and Phenytoin. Also, sodium valproate works over here. Lamotrigine can also work on the sodium channels, and they can block the sodium ions blockage. So sodium ions will not be able to enter inside furthermore. Over here, calcium ions will not be able to enter inside, which causes the blockage of the action potential and eventually causes the lower abnormal motor discharges, motor electrical signals from the brain to our body. So now let's really classify the drugs, that how they are working and in which category what drugs are there. So let's classify the drugs, and then we will talk about the drugs one by one. So let's classify the drugs. Now in present time, there are many drugs discovered. Now, like in ancient times, carbamazepine was the first line drug for many kind of seizures or epilepsy. But nowadays, valproate is a very famous drug. This is the most latest one. Also the ezogabine, which is the latest discovery, they opens the potassium channels over there. So let's classify the antiepileptics. Actually, you can classify them in 4 parts. They are sodium channel blockers, sodium channel blockers, okay, calcium channel blockers, okay, T-type calcium channel blockers, also GABA receptors agonism, and potassium channel openers. Potassium channel openers. So if you classify the sodium channel blockers, there are many drugs. Like first one, carbamazepine, oxcarbamazepine, phenytoin, phenytoin, okay. Valproic acid can also be used. As I said that this is the broad spectrum antiepileptics. Also lamotrigine, felbamate can also be used, okay. Also if you can add topicamate. So these are some drugs which can work on the sodium channels and will further stop the influx of the sodium ions into the neurons and can stop the abnormal motor discharges from the brain or CNS. Now carbamazepine, remember about this, that carbamazepine, what is the specialty of this? That they are very effective in the partial seizures. They are very effective in the focal seizures. Remember we have studied the partial seizures, focal seizures in the previous discussion, and we have studied that they are classified into simple and complex and also secondary generalized, which further can be converted into the generalized seizures. But carbamazepine is the first drug choice as far as partial or focal seizures are concerned. So carbamazepine is the first line drug for the partial seizures. Now if you classify the calcium channel blockers, so calcium channel blockers, there is ethosuximide, there is valproic acid. Now valproic acid is everywhere. Sodium channel, they can block the sodium channels, they can block the calcium channels, they can work on the GABA receptors, so they are everywhere. That's why the most widely used drug in the antiepileptics is the sodium valproate or valproic acid. So also lamotrigine, now lamotrigine and valproic acid are using in the sodium channels. I have told you about the valproic acid. This is the broad spectrum antiepileptic, but lamotrigine can also block the sodium channels as well as the calcium channel. It depends on the doses of the lamotrigine, that how much dose you are giving, okay. So this was about the calcium channel blockers. If you talk about the GABA receptor, I have told you that there are the three sides. If you talk about the phenobarbitons, then there is phenobarbital. If you talk about GABA receptor, GABA site, so which can work over there, valproic acid, sodium valproate, okay. Also gabapentin can work over there, okay. Also vigabatrin. Now if you classify the benzodiazepines, remember there is the benzodiazepines site 2. So GABA receptor is very big receptor as compared to the other receptors. So benzodiazepines, so what will be the benzodiazepines, right? Benzodiazepines. Now benzodiazepines, what drug are classified? Lorazepam, clonazepam, clobazam, diazepam, okay, clobazam. So these are the drugs which classify under the benzodiazepines, very famous drugs. And especially the diazepam is the very famous one. Diazepam is the very famous one. Diazepam, lorazepam, okay, diazepam, lorazepam, clonazepam, also clobazam you can add, clobazam. Also the diazepam, remember about this, the diazepam is also very useful in the status epilepticus. That is very dangerous stage, or you can say the last stage, life-threatening stage of the epilepsy. If there are the episodes of seizures longer than 5 minutes, in previous times it was about the 20 minutes, that if the seizures are lasting more than 20 minutes, then we can consider it status epilepticus. But nowadays they have changed it till 5 minutes. So if they are longer than 5 minutes, then there could be the status epilepticus. In those cases, diazepam, in those patients, diazepam is first line drug in the benzodiazepine sections. Now, these two are about the, actually these three about GABA site. Okay. Potassium channel openers, there is new discovery. You can add ezogabine over there. How you can understand that ezogabine would open the potassium channels rather than blocking them, open the potassium channels and causes the potassium efflux from the neurons, because the potassium are more inside the neurons, right? So they will cause the potassium efflux. By opening them, they will cause the potassium efflux, which will cause hyperpolarization of the neurons, and the neurons, it will be very difficult for the neurons to excite, to depolarize, or to generate the action potential. So that's how they work as an anti-epileptic agent. So they are newly added to this classification. The specialty about the ethosuximide, if you will see, ethosuximide over here, ethosuximide are more helpful or first line drug in absence seizures or petit mal seizures, because this is the small seizures, petit means small, so absence seizures or petit mal seizures more often seen in children. So ethosuximide is the first line choice, first line drug, okay, drug of choice. Ethosuximide as far as absence seizures or the petit mal seizures are concerned. However, remember that if the child is younger than 2 years old, then ethosuximide would be the drug of choice. After that, valproic acid is the first line drug for the absence seizures. Now, let's talk about them one by one. About the carbamazepine. Carbamazepine, as I told you, that remember that it is the best drug of choice or first line drug as far as partial seizures are concerned or focal seizures are concerned. Carbamazepine is also used in the trigeminal neuralgia. Remember that they are also useful in the trigeminal neuralgia. Okay, they are metabolized in the liver. Also, they are the inducers of the liver enzymes. Okay, metabolic liver enzymes. And oxcarbamazepine. Oxcarbamazepine is nothing but it is the modification of the carbamazepine. Okay, and these have less side effects. If you talk about the adverse effects of the carbamazepine, the side effects or adverse effects of the carbamazepine, so what they can cause? They can cause the agranulocytosis in the blood. They can cause alopecia, that is hair loss, nausea, vomiting, anorexia, vertigo, diplopia, which means the double vision. Means these are the common signs and symptoms as far as anti-epileptic drugs are concerned. Apart from that, alopecia, also hypersensitivity reactions, okay, agranulocytopenia, as I've told you, aplastic anemia, okay. So these are some kind of adverse effects. Also the water retentions, because they causes the antidiuretic action, because in some patients the patient loses the control over the detrusor muscles, though they can lose their urine, they can pass the urine without control over them. So they can pass the stools, they can pass the urines. So also to treat that, carbamazepines are much helpful because they have the antidiuretic action. So related to that, as they are antidiuretic, so there could be the water retention in the patients, which is included in the side effects of carbamazepine. So this was about the side effects of the carbamazepine. Carbamazepine have much less side effects as compared to the carbamazepine. This is the modification drug for the carbamazepine. Let's talk about the phenytoin. Phenytoin is the non-sedative drug, which is the specialty of this drug, phenytoin. This is the more non-sedative drug. Also, initially it follows the first order kinetics, but later on, as the time passes in our body, this drug, so it will lead to the zero kinetics. First order kinetic, it initially follows the first order kinetics, and then it follows the zero order kinetics. About the first order kinetics or zero order kinetics, I have already discussed this in pharmacodynamic or pharmacokinetic videos, so you can go to them and check about this. So initially they follow the first order kinetics and then they follow the zero order kinetic. This is the important point, and as far as MCQ are concerned, this is the most important point in the phenytoin. That firstly, initially they follow the first order kinetics, and then later on they follow the zero order kinetics. Also, phenytoin must be avoided in the pregnant ladies, also the ladies which are normal or girls. Okay, why? Because the side effects are not so good. Alopecia, hair loss, gum hypertrophy is the most commonest one as far as phenytoin is concerned. So there will be the gum hypertrophy. Okay, they will start losing their teeth, gums hypertrophies. Okay, alopecia. These patients could have the hyperglycemia, ataxia problems, vertigo problems, nausea, vomiting problems. Of course, with all the almost all the anti-epileptic drugs. Also, I talked about the ataxia, hypersensitivity reactions in the pregnant ladies. They can cause Phenytoin-Hydantoin syndrome. Which are the characteristics of this? Cleft palate, hair lip, Downs-like syndrome. Okay, so they can cause Phenytoin-Hydantoin syndrome. This should be avoided in the ladies, especially in the pregnant ladies. So this was about the phenytoin. Phenytoin is the prodrug of the phenytoin, and it's more effective as compared to the phenytoin. As compared to phenytoin, they have the less adverse effects or less side effects. Okay, so also it is a prodrug. Also it is more water soluble. So while giving the IV, phenytoin is actually irritating the patients, but phenytoin is much more soluble with the solutes. Okay, much more soluble with the solutes or saline. So there are much less problems while giving the IVs. Valproic acid is the important one, as it is broad spectrum, works on all kinds of channels or receptors, most of them especially. So valproic acid, they are the first line drugs for the general tonic clonic seizures. Also they can use for the partial also, but general tonic clonic seizures, myoclonic seizures, absence seizures, grand mal seizures, petit mal seizures, you can use everywhere. But the grand mal seizure is the first line drug for the grand mal seizure, will be the valproic acid or sodium valproate. Also, they blocks the sodium channels, they can block the calcium channels, they can block the GABA sites, okay, and influences the chloride influx, which will lead to hyperpolarization of the membrane of the neurons, and will lead to the blockage of the action potential over there, and which will lead to eventually stoppage of abnormal motor electrical signals from the brain. Okay, so adverse effects of the valproic acid. Adverse effects of the valproic acids are hepatotoxicity, okay, Again, nausea, vomiting, diplopia, these are the most common side effects. Okay, hepatotoxicity will be there. Okay, can be granulocytosis, alopecia, hair loss. These are the common adverse effects with the valproic acids. Okay, so lamotrigine also they works on the sodium channels as well as calcium channels. They block these channels, and also they are used for the uh, partial seizures and in the myoclonic seizures. Phenobarbital and topicamide, they also block the sodium channels, but the most used drug is the valproic acid, lamotrigine. Phenytoin is much helpful as compared to the phenytoin, and oxcarbamazepine and carbamazepine are the most widely used drugs as far as partial seizures, focal seizures are concerned, because these are the first line drugs for the partial seizures. Move on to the calcium channel blockers. Ethosuximide, as I told you, these are the first line drugs for the calcium for the absence seizures or petit mal seizures. They are used only and only for the absence seizures, especially because we have more drugs to add with this drug. Okay, valproic acid, I told you about that already. It works on all the channels. They works on the receptors, NMDA receptors or AMPA receptors. They can work, or lamotrigine, I told you that they can block the sodium channels and calcium channels. Depends upon the doses of this drug. Also, if you talk about the phenobarbitals, remember we have the phenobarbital sites in the GABA receptors. So there they can cause the influx of the chloride ions and can cause the hyperpolarization of the neurons and can block the normal motor discharges from the brain. Also, phenobarbitals are used for the partial or myoclonic seizures or general clonic tonic seizures or GTCS, general tonic clonic seizures. Valproic acid, again, we can use over here. In most of the patients, valproic acid is very common. So in most of the patients, you will see that in the medications they are using their valproic acid among the anti-epileptic medications. Okay, so also GABA can be influenced by the valproate, sodium valproate or valproic acid, because they can block the GABA transaminase. Okay, and there are some drugs which can, for example, here is the presynaptic left and here is the postsynaptic left, and here the GABA is coming. Okay, it comes over here. Okay, and it will further, it will go to the for the uptake. So GABA will be uptaken by the presynaptic left. So some drugs like this one, vigabatrin, they can block the uptake of the GABA, which will lead to more and more GABA accumulation in the synaptic gap. And what will it do? More and more GABA will be able to bind to these GABA sites of the GABA receptors, and they will be able to hyperpolarize the neurons and to avoid the depolarization or action potential of the neurons. Okay, so this is the work of the vigabatrin. Also, sodium valproate or valproic acid can work upon the, actually there are enzyme which converts this enzyme is GABA transaminase, okay, GABA transaminase. So what will it do? It helps the conversion of the GABA. So GABA transaminase will be inhibited by the valproic acid in higher doses. Okay, so valproic acid, why it is more effective? Valproic acid can block the sodium channels, and over there they can stop the motor signals. Okay, can block the calcium channels. Okay, by exciting the GABA sites, in the inhibition, so they can block, they can induce the GABA sites. So GABA will be accumulate in the synaptic gap, and they can cause the chloride influx. With that, they will be helpful in the potassium channels openers. Okay, and also they can block the GABA transaminase. Okay, now we left with the benzodiazepines. So diazepam is more useful in the status epilepticus, convulsions, okay, in the contractions, severity, muscle rigidity severity, okay. So these are much more helpful. Also the lorazepam, clonazepam, clobazam, these are the similar drugs. They are used as anticonvulsants and antiepileptics. They're much more useful in the status epilepticus. Diazepam is the first line drug, best drug of choice for the status epilepticus, okay. So ezogabine, I have already discussed that these are they helps in the opening of the potassium channels and will cause the hyperpolarization of the neurons and will eventually stimulate the motor discharges, abnormal motor discharges. So in conclusion, also one more very important thing about the very important point about the antiepileptics, that usually doctors, they gradually increases the dose of the patients, okay, and they gradually decreases the dose of the patient also. So if a patient, and this course of treatment is usually very longer, for example 2 years, 3 years, 4 years, depending upon the conditions of the patient. Various kinds of patients have various kinds of course of treatment, but usually they have the longer course of treatment. So this was about the anti-epileptics. We have talked about almost all the drugs. These are the more basic one and more widely used in the epilepsy. So I hope you like this video and will be helpful in understanding you the epilepsy and the treatment of the epilepsy. Thanks for watching this video. See you soon.